Good evening, all my dear students, OET aspirants. Welcome to another session of our OET Speaking, our live platform, virtual platform. Welcome you all on behalf of B-GHUD family. അപ്പം പ്രിയപ്പെട്ട എല്ലാ സ്റ്റുഡൻസും നന്നായിട്ടിരിക്കുന്നു, സന്തോഷമായിട്ടിരിക്കുന്നു, ആരോഗ്യമായിട്ടിരിക്കുന്നു എന്നൊക്കെ വിചാരിക്കുന്നു. സോ നൗ വി ആർ നിയറിംഗ് ടു അവർ ഓണം സീസൺ, ഓണം സെഷൻസ്. ഓക്കെ, ഓണം സീസണും സെഷൻസും ഒക്കെ സ്റ്റാർട്ട് ചെയ്തുകൊണ്ടിരിക്കുകയാണ്. അപ്പോൾ എല്ലാവരും ഒരു കളർഫുൾ ജോയ്ഫുൾ മൂഡിലാണെന്ന് വിചാരിക്കുന്നു. ഓക്കെ, അപ്പോൾ എല്ലാവരും നന്നായിട്ട് എൻജോയ് ചെയ്യുക, ഓണമൊക്കെ സെലിബ്രേറ്റ് ചെയ്യുക. നമുക്ക് ഇനി ഒരു സെഷൻ കൂടെ വരും ഓണത്തിന് മുമ്പായിട്ട്. നെക്സ്റ്റ് സെഷൻ എന്ന് പറയുമ്പോൾ നെക്സ്റ്റ് ഫ്രൈഡേ. സോ ദാറ്റ് വുഡ് ബി ദ session which would be very next to this, very close to our Onam session. Okay, next Sunday is Onam, not this Sunday, the next Sunday. Okay, so before that we'll be having one more session. And then we will onathinte vibe. Today is Attam. So today itself, let me wish you all a prosperous, joyful and delightful Onam. All my dear students, OET aspirants, by next year this time, may God the Almighty shower His blessings upon you all to celebrate your Onam in your dream destinations by next year. ഓക്കെ, അപ്പോൾ അടുത്ത വർഷം ഇതുപോലെ സമയത്ത് എല്ലാവരും വിചാരിക്കുന്ന രാജ്യങ്ങളിലൊക്കെ പോയിരുന്ന് ഓണമൊക്കെ സെലിബ്രേറ്റ് ചെയ്യാനായിട്ട് ദൈവം അനുഗ്രഹിക്കട്ടെ എന്ന് ഒരു വിത്ത് മൈ പ്രേയേഴ്സ്, ഹാർട്ട്ഫുൾ പ്രേയേഴ്സ് ആൻഡ് വിഷസ് ഫ്രം B-GHUD ഫാമിലി. ഓക്കെ, അപ്പോൾ B-GHUD ഫാമിലിയിൽ നിന്ന് എൻ്റെ പ്രിയപ്പെട്ട സ്റ്റുഡൻസിന് എല്ലാവർക്കും once more and again I'm just wishing you all the very good luck and all the very best. Okay, so ഇന്ന് നമുക്ക് today, so because of some technical concerns, our Facebook live is not going on. So today we'll be having the whole live presentation through YouTube channel. Okay, അപ്പോൾ നമ്മുടെ ഫേസ്ബുക്ക് ചാനലിലെ കുറച്ച് ടെക്നിക്കൽ എറേഴ്സ് കാരണം നമുക്ക് ഇന്ന് പോകാൻ പറ്റുന്നില്ല. അതുകൊണ്ട് നമ്മൾ കംപ്ലീറ്റ് ലൈവ് സെഷൻ ഇന്ന് പോകുന്നത് യൂട്യൂബിലായിരിക്കും. സോ ഐ വോണ്ട് ഓൾ ഓഫ് യു ടു ഗെറ്റ് സബ്സ്ക്രൈബ് ടു ദ യൂട്യൂബ് ചാനൽ. സോ ഇൻ ദ യൂട്യൂബ് വെർച്വൽ പ്ലാറ്റ്ഫോം പ്ലീസ് ടു എൻജോയ് ദ ക്ലാസ്. ഓക്കെ, നമുക്ക് കഴിഞ്ഞ ആഴ്ച കിട്ടിയിരുന്ന ഒരു ക്വസ്റ്റ്യൻ ആയിരുന്നു. ടുഡേ ഐ വിൽ ബി ഡിസ്കസിങ്. നോ അതർ കൺസേൺസ് ഹസ് ബീൻ റേസ്ഡ് ഫ്രം അവർ സ്റ്റുഡൻസ്. ഓക്കെ, നമ്മുടെ 33rd ലൈവ് സെഷൻ ആണ് കഴിഞ്ഞ ക്ലാസ്സിൽ. സോ അവർ past session, so we have got a question from our student side, so I'll be discussing that sort of question, and many people are sending me comments like they all are finding very useful with these classes. Thank you for appreciating, thank you for good words. Your words means a lot. Okay, so your words means a lot for us, so that sort of appreciation will be able to improve our quality when it comes to your appraisal and your appreciations. Critical appraisal is most welcomed. Okay, അപ്പോൾ എന്തെങ്കിലും കുഴപ്പമുണ്ടെങ്കിൽ നിങ്ങളുടെ അടുത്ത് പറയുക. Will be able to upgrade and more fruitfully will be able to present our classes for you. Okay, അപ്പോൾ നിങ്ങൾ എന്ത് സജഷൻസ് ആണെങ്കിലും പറയുക. I want all of you to extend your hands. Okay, extend your hands and join with us for making this sessions all possible. So I would like to thank all my dear behind camera crew members, Mr. Vipin, Mr. Jobin, and my dear Guy for making this session possible. Okay, so thank you my dears. It's because of them I'm just presenting these classes. It's because of my technical crews all these things are going on well. Okay, so on behalf of you also I'm just extending my heartfelt thanks. So now we'll come to the class. I'll be discussed straight away. We are moving to the question because no other concern has been raised from our students. Always I ask you to present, you put for your concerns, the questions that you feel like asking. Okay, so today no concerns has been raised, so I'm just moving straight to the question which was sent to me by one of our students during the last session. Okay, please Jobin, you can play the question. So now it will be displayed there. You can have a thorough reading of the question. Here comes the question. Okay, all my dear students, so I hope you have all gone through the question. So let us start discussing the question. Setting is a hospital outpatient clinic. Okay, setting is hospital outpatient clinic. You are giving 52-year-old patient information about a transesophageal echocardiogram. Okay, TOE. he or she is going to have next week. So only a small information has been given over there. Setting it is given like hospital outpatient clinic. Outpatient in the sense you can expect many patients to come to that site. The patient is 52-year-old. Next week TOE has been booked for this patient. Okay, TOE means transesophageal echocardiogram has been scheduled for this patient. So next week. Now we are giving more information about that. Okay, my dear students. Confirm the patient is scheduled to have a TOE. Okay, find out if the patient has had one before. So this he or she it is given like, so depending upon the examiner you could consider the gender of the patient, you can go like that. Okay, so this is a outpatient clinic. Confirm. Okay, confirm in the sense you can either start the topic by collecting the health records and asking them to repeat their name, or you can straight away you can ask and you can confirm, are you Mr. So and so, am I talking to so and so. Likewise also you could start. So these are the two ways by which we can go for confirming the identity and confirming the necessity of their arrival. Okay, so we can confirm their identity as well as we can assess the necessity of their the necessity of their arrival, why they are there. Okay, so we have to confirm that. Find out if the patient had one before. So we need to ask whether whether this patient is here for the first time or whether the patient had any sort of TOE before. Okay, so that is what the thing is. Fine. Next one is like explain the function of TOE. Why we are doing this transesophageal echocardiogram that we need to explain. See, provide detailed images, check structure of heart, analyze blood flow, enable planning of surgery or treatment. So these are all the purpose of this TOE that we need to explain them clearly. Okay, next one is like outline pre-TOE requirements, pre-procedure. Okay, how it would be, what all the pre-procedure assessments or preparations that is needed that we need to explain the patient, like avoid food or drink 6 hours before. Describe preparation at the hospital, that means pre-preparation, intra-preparation. Okay, that means anesthetic spray, light sedation, mouth guard, all those things that we need to explain to the patient. Okay, next one is like advise patient about the after effects. Okay, so post procedure, what are all the discomforts that they could come across, that also we need to explain to the patient. Okay, so that means possible minor discomforts like soreness, drowsiness and all. Outline post procedure steps. So post procedure, what all we will be doing, like pre discharge observation period, post discharge accompanied, no drying for 24 hours. So all those things you have to appraise and can construct needed information for the patient. Okay. Next thing is like find out if the patient has someone to support him or her post discharge. So regarding their assistance, assistive services, assistance strategies, assistance situation, whether the patient has got anyone to support or accompany or to assist in the activities of daily living, because driving and all is contraindicated for another 24 hours. So we need to explain all those things to the patient. Fine. Next one is like give information about scan results. Okay, regarding the results also we can give an information like analyze, it will be probably 1 to 2 weeks, subsequent follow-up appointment with GP. So this is all what regarding to the question. Okay, the role play. I think the situation is clear to all my dear students. Yes, yes, all of you. I think all are getting me. So now we can start the procedure. Sorry, I'm just like procedure, I'm just coming like no, I'll go for discussing the role play. Now I think the discussion is over. Now I will give you the notes by explaining each and everything. You can take down the notes, you can listen to me. So more than you focus on this writings, no, just to see how the intonation is done, how the organization is going on, all those things you have to carefully observe, because intonation and organization are most essential parts when it comes to speaking. Your speaking will become mellifluous, natural and more vibrant if intonation is applied at the site. Ups and downs in the voice should be there depending upon the situation. Fine. Organization means depending upon the priority of the situation, extending to the concern of the patient. All these things we have to take a great care while considering this role play. Okay, I want all my dear students to focus first of all on intonation and later on organization. So these are the most important parts of a question. Okay, important parts of speaking session. Fine. So yes. So confirmation in the sense how to start this topic. Okay, I cannot interact with my students because it is on YouTube platform. If you have got any suggestions, you could pin your suggestions, you could ask your comments over there. I'll be able to discuss it for you. Okay, never feel shy or inferior because your questions and your concerns, queries make us more and more energetic. We'll feel like you all are watching and you all are making use of it. I know that all are making use of it because we are getting enough and enough of feedbacks. They all are telling me more about the session. That means all these exam questions they are making use of. Just try with these models. You'll be getting any sort of models like this. Okay, you could approach any sort of questions if you go for this. This is our 33rd session. Okay, so almost all types of exam sort of questions we have discussed so far. Just go for that. Just listen that and see how what methodology we have applied to deal with all these questions. Okay, my dear students. So let's start discussing this role play. Okay, hope all are ready. The first task, introduction, is no much information has been given in the scenario, so it is very easy to start. How we can go for a pleasant information? Yes, how we can go for a pleasant information? Tell me, my dear students. Okay, so confirm, hospital outpatient clinic. So I told you there are two ways by which one you can collect the name, or you can just ask for the health records and can ask them to repeat the name. These are the two ways by which we can start the introduction of the session in this particular scenario. Okay, so if you want question means once in a while they will be displaying the question. Okay, yes. So how can go for introduction? Okay, good morning, please come in. Take your seat. Good morning, please come in, take your seat. My name is Abhilash, I'm the charge nurse. Okay, because our role is given like we can discuss anything. Good morning, please come in, take your seat. I'm Abhilash, the charge nurse. Okay, how may I help you? Okay, how may I help you? So the patient will be saying like, then the patient will be saying like, oh nurse, I'm here for to know more about a procedure, so I'm really very doubtful about that, I want your help. So the patient is expressing their concern. So in response what we can say like, okay, surely I will help you, you don't have to worry, surely I will help you. Can you please hand over me your health records? Can I have your health records please? Okay, can I have your health records please? So they will be, thank you. Could you, and for a double check, could you please repeat me your name? And for double check, could you repeat me your name? And for a double check, could you, if you can avoid the word double check also, could you repeat me your name? Okay, for confirmation, or could you repeat me your name? Or for a double check, could you repeat me your name? Okay, so they will be saying like, my name is Peter. Pleasure meeting you, Peter. Okay, pleasure meeting you, Peter. So you are you have been scheduled for transesophageal echocardium next week. Am I correct? Okay, so you have been scheduled for transesophageal echocardiogram next week, isn't it? Or am I correct? So this is how we are going to confirm. Otherwise you can start like, good morning, please come in. If I'm not wrong, you're Mr. Martin, you're Mr. Peter, who's scheduled to have a TOE next week. Am I correct? So this is another way by which we can start the topic. So confirmation in the sense, because the patient is scheduled, so we can collect health records and we can make it more a fleshy some sort, as a detailed manner by which we are collecting the introduction. Good morning, please come in, take your seat. I am Abhilash, the nurse registered or the nurse in charge. Okay, how may I help you? So they'll be saying like, oh nurse, I have got a procedure, I'm quite confused. You don't have to worry, surely I will help you. Can you please get me your health records? Can I have your health records please? Can I have your health records please? We'll be giving you, thank you. For a double check, for confirmation, could you repeat me your name? Could you repeat me your name? So we'll be saying, look, thank you, pleasure meeting you, Mr. Peter. So you are scheduled to have, okay, so I've been scheduled to have a transesophageal echocardiogram next week, right? Okay, you are supposed to undergo a procedure next week. You have been scheduled for transesophageal echocardiogram next week. Am I correct? So this is how we are confirming the thing. So wherever you use the procedure, never say like TOE. Okay, for your communication and all throughout the procedure, you can use the full form of that procedure, transesophageal echocardiogram. So the patient will be saying like, yes, nurse. It seems you're very nervous, it seems you are anxious. Well, is it the first time you are undergoing for such a procedure? So we are just asking, confirming with the patient whether it's the first time. It seems you are quite anxious. Are you here for the first time? Are you here for the first time? Okay, are you here for the first time? Are you here for this procedure first time? So likewise you can ask. It seems you are quite nervous, you are quite anxious. Well, are you here for this procedure first time? Do you have any previous incidences? Do you have any previous incidents? Okay, any previous history? So likewise you can just confirm the patient's identity, okay, the patient's confirmation. So we can confirm the status of the patient. I hope it is clear so far, all my dear students. Well, it seems you are quite anxious. Are you here for this procedure first time? Any previous incidences? Okay, any history? I would like to know. So the patient will be saying like, no nurse, I'm just here for the first time. I don't know anything about this procedure. Please help me, nurse. Okay, surely I told you, no, I will help you. You don't have to worry. Please, no, don't be anxious or don't be nervous. Any sort of, depending upon the patient concern or expression, don't be nervous, don't be anxious. We are here to help you. Don't worry. Okay, see, transesophageal echocardiogram, it is a normal procedure. Okay, transesophageal echocardiogram, it is a normal procedure. Okay, it is usual. Okay, it is usual, it is commonly done among patients. It is usual, it is commonly done among patients. Transesophageal echocardiogram, it is usual, okay, it is commonly done among patients. Okay, so the structure you can, this is done to assess the structure and function of heart. Okay, this is done to assess, this is done to assess the structure and function of heart. Okay, so it provide detail, it is an imaging procedure. Okay, it is an imaging procedure that provide detailed structure analysis. Okay, that provide detailed structure and function of heart. Okay, we'll be able to assess the blood flow. We would be able to assess the blood flow, analyze the blood flow. Okay, so it is a definitive diagnostic procedure. It is a definitive diagnostic procedure by which doctor could be able to fix definitive management if needed further tests or observations. Okay, so this is how we are going to explain the procedure. Okay, you don't have to be anxious. The second task I'm just telling you once again, you don't have to be anxious. Okay, no need to be, no worries, you don't have to be anxious or confused. See, transesophageal echocardiogram, it is a normal procedure, it is usual. Okay, it is commonly done among many patients. Okay, it is commonly done among many patients. Actually, it is an imaging procedure. It is an imaging procedure by which we could obtain detailed images of structure of heart and even the function like analysis of blood flow and even the function like analysis of blood flow. Okay, it's a definitive diagnostic test. It is a definitive diagnostic test so that the doctor, okay, it is a definitive diagnostic test by which the doctor would be able to fix the definitive management and if necessary some further tests or procedures including surgeries. So this is so, okay, this is a definitive diagnostic test by which the doctor could fix the definitive management or the doctor could fix the treatment or if needed or if necessary further tests or observations or procedures like surgeries. Are you getting me? Are you getting me? So the patient will be saying like, yes nurse, I'm getting you nurse, I'm getting you. Okay, so how would I be able to go for this procedure? I really don't know anything about the preparation and all. Okay, you please listen to me, I'm here to help you. So patient will be saying like, I'm really anxious about this procedure. I don't know how to get prepared for all these things. I'm totally unaware of this. I'm totally blank. I understand. I know that you're quite nervous. I understand. I know that you are quite nervous. See, I will explain you each and everything. Okay, I will explain you each and everything. Any queries, feel free to ask. Any queries, feel free to ask. Okay, so the preparation starts before 6 hours. See, the preparation for transesophageal echocardiogram starts before 6 hours. I mean, you are not supposed to take anything through your mouth. You're not supposed to take anything through your mouth. That means you will be kept on nil per oral. You will be kept on nil per oral. before 6 hours of the procedure. Before 6 hours of the procedure. Actually, the procedure starts before 6 hours. I mean, you will be kept on nil peroral. No food or fluids are allowed through mouth. No foods or fluids, or no food or fluid is allowed through your mouth. Okay, this is a part of pre-preparation. See, we are just giving. Yes, and inside hospital, you have to be here at correct time. Okay, you can perform oral hygiene and have to be here at correct time. Okay, so that procedure starts at hospital, and later procedure starts at hospital. Okay, inside the procedure room, you will be taken inside the procedure room, and anesthetic spray will be done. And an anesthetic spray will be done. Okay, and an anesthetic spray will be done. Okay, there will be a slight sedation. Okay, there will be a slight sedation. You will be totally awake, but there will be a slight sedation. Okay, in order to make the flexible entry, there will be a slight sedation. You will be given an anesthetic spray. There will be a slight sedation. You will be entirely awake, but there will be a slight sedation. Okay, you will be given an anesthetic spray. You will be awake, but there will be a slight sedation. Okay, and later a mouth guard will be applied. Okay, and later a mouth guard will be applied for the flexible entry of the tube. So through a tube we are going to do this procedure, and later a mouth guard will be applied for the flexible entry of the tube. So this is how we are describing how the procedure is. I hope you are getting me. The patient will be saying like, yes nurse, see the procedure, I know, I can understand that you're quite nervous. No worries, I can understand. So once again I'm repeating, I can understand that you're quite nervous. Don't be afraid. Okay, the procedure, the preparation actually starts before 6 hours. You will be kept on nil peroral. I mean, no food or fluid be given to your mouth. This is a part of the procedure. And you have to be here at correct time. You have to be here at correct time. After taking mouth care and all hygienic activities, you can come here. At hospital, inside the procedure room, you will be given an anesthetic spray. You will be given an anesthetic spray. You will be entirely awake, but there will be a slight sedation. There will be a slight sedation. After that, a mouth guard will be applied for the flexible entry of the tube. After that, a mouth guard will be applied for the flexible entry of the tube. Are you getting me? That's all regarding the procedure. That's all regarding the procedure. Okay, so they will be asking like, nurse, any sort of discomforts? I'm afraid of pain. No, not at all. That won't be painful at all. No, not at all. That won't be painful at all. Okay, it won't hurt you much. It won't hurt you at all. It won't hurt you at all. No, not at all. It won't hurt you at all. Okay, you may have some slight side effects. You may experience some slight discomforts. You may have some slight discomforts, like minor discomforts like soreness, drowsiness and all. Okay, you may experience some minor discomforts like soreness and drowsiness. Okay, that's only for a short term. It will go away by itself. That's only for a short term. It will go away by itself. That's only for a short term and it will go away by itself. That's only for a short term and it will go away by itself. Okay, after that you will be after the completion of procedure, you will be having a post procedure observation. You will be kept for post procedure observation. Okay, so that will be done before discharge. Okay, before discharge you will be observed. Okay, there is an observation period. You will be observed for a few hours. Okay, and after discharge, it is a must that you have to be accompanied by someone. It is a must that you have to be it is a must that you have to be accompanied by someone. So I want you to arrange your friends, relatives or close someone who is close to you. Okay, will you be able to do that? See, driving and all other strenuous activities are contraindicated for another 24 hours following the procedure. So you should arrange someone to take care of you. You should arrange someone to take care of you. You can resume all your normal activities after 24 hours. You can resume all your normal activities after 24 hours. Okay, well, who will be there to take care of you? Is there anyone to accompany you? Okay, who will be there to take care of you? Is there to accompany you? Please tell me. Please do the needful. So this is how we can deal with that second last task. That is the fourth task. So once again, I'm going to repeat that. The patient will be asking like, oh nurse, would that be painful? Nurse, I'm really very worried about the procedure. No, not at all. It won't hurt you at all. Okay, you may have some slight minor side effects. Okay, you may have some minor discomforts. You may feel some minor discomforts like drowsiness and soreness. These are only short term, that will go away by itself. These are only short term, that will go away by itself. Okay, after the procedure, you will be kept on observation before discharge. After the procedure, you will be kept on observation before discharge. Okay, a few hour observation will be there, and you will be allowed to go back home once everything is stable. And once everything is stable, you will be allowed to go back home. But it is a must that you should be accompanied by someone. Okay, an assistance is needed while going home because driving and other strenuous activities are contraindicated for 24 hours. And try to arrange someone for your assistance. Well, tell me who is there to take care of you, who will be there to assist you, who will be there to accompany you. Okay, make sure that someone is here. Do the needful. Okay, do the needful. Okay, do the needful. Okay. You can resume all this. The patient will be about my activities. You can resume all your normal activities after 24 hours. You can resume all your normal activities after 24 hours. No worries. No worries. Okay, this is how we are just going to convince and come and compose the patient. Okay. So there will be any other queries for me? Peter, any other queries for me? Peter, I think the name I used was Peter. Any other queries for me, Peter? So they'll be saying like, what about the scan nurse, result nurse? I don't have to wait for long. I want this result to be there with me as early as possible. Okay, so I value your fields, but you have to be patient. I value your fields. And the patient seems to be in a hurry. We have to, I cannot wait for long. So even I will have my results. I want it to be as early as possible. I value your fields. I respect your fields. I know what you're saying. I value your says. I value your fields. I know what you are saying, but let me tell you have to be patient. Okay, but you have to be patient. Okay, scan analysis may take probably 1 to 2 weeks. Scan analysis may take probably 1 to 2 weeks. Okay, scan analysis requires probably 1 to 2 weeks. Scan analysis requires probably 1 to 2 weeks. Okay, you will be informed once the results are out. You will be informed once the results are out. You will be informed once the results are out. You can come here and can collect the results. Then you can come here and can collect the results, and thereby and after that you can come and collect the results. At the same time, you can have the appointment with the GP. At the same time, you can have an appointment with the GP so that the doctor will let you know sure about your health situation. Okay, so you will be informed. So this is how we are going to convince the patient. I value your fields, but see, you have to be patient. Scan analysis requires probably 1 to 2 weeks. Once the results are out, you will be informed. Then you can come and collect and can have an appointment with your GP and can have an appointment with your doctor or GP. Okay, they will explain you everything. They will let you know that for sure. They will let you know more about your health situation. All right, understand. All right, are you getting me? Understand, following. Okay, so they'll be saying like yes. Depending upon the test result, the doctor will advise you what are all the further actions needed. Depending upon the test result, the doctor will explain you what are all the further actions needed. Okay, you can act accordingly. Okay, you can act accordingly. Okay, don't worry, stay positive. You'll be having a hope you'll have a healthy result. Okay, you be confident, be optimistic. You be confident, be optimistic. Hope you'll be having a normal and healthy report. Okay, so this is how we are going to. Okay, you don't have to worry, you'll be all right. Okay, nothing to be overly concerned about. Stay positive, be confident, nothing to be overly concerned about. Stay positive, be confident, nothing to be overly concerned about. Okay, so this is how we are going to explain the things to the patient. So the patient will be saying like, thank you. Is there anything else that you would like to ask or discuss, Mr. Peter? Is there anything else that you would like to ask or discuss, Mr. Peter? Anything else is bothering you? So they'll be saying like, no, nurse, I'm all right, I'm perfectly all right. Thank you for, I feel like more informed. Thank you for coming to me, Peter. Thank you for coming to me, Peter. Hope you're more informed. Thank you for coming to me, Peter. Hope you are more informed. Okay, now you may leave. Okay, now you can you may go now. Okay, and or you can say like now you can go, you can make a move. Likewise, you can tell like, okay, thank you for coming to me. Okay, so this is how we are going to. Well, thank you for coming to me. It was really a pleasure talking to you. See you next week. Till then, take care. See you next week, because the patient has to come next week for this procedure. See you next week. Till then, take care. This is how you can end up the conversation. Okay, thank you for coming to me, Mr. Peter. It was really a pleasure talking to you. See you next week. Okay, see you next week. See you next week. Till then, take care. Bye. Till then, take care. Bye. So this is a pleasant conclusion that you can give to the patient depending upon the situation, because the patient is going back, they will be coming after 1 week for this TOE. So this is the best sort of conclusion that you can give to your patient. Hope everything is clear to all my dear students. That's all regarding the topic. So our 34th session will be on next Friday before the very next before Onam days. Okay, so we'll be discussing another interesting topic next week. Okay, so if you have got any questions with me, send to us any queries or any concerns or questions. What sort of doubts that you are having in relation to this OET, you can send to me. We'll be discussing according to your request. Okay, so we'll be eagerly waiting for your response. We are eagerly waiting for your queries. Okay, that will make us more and more confident and enthusiastic. Okay, thank you for all your support. Once again, I would like to thank Mr. Jerin, Robin and Vipin for making this session possible. Okay, so see you all next week. Till then, take care, my dear students. All the best. God bless you all. Bye.